Well, thousands of American doctors are finding themselves in a dilemma. The changing healthcare market is causing many to give up private practice and take salaried positions with hospitals instead. Dr. Kathleen London writes in the New York Times, quote, "I think the days of what I did in 1999 are over. I don't think that's possible anymore." The woman who wrote those words, Dr. Kathleen London, joins us now. Over why?
It's a very different environment, and it predates healthcare reform, so I want to make that clear. And it started even in the 90s when I was in residency. We had at the facility that I was at in Oregon, we had somebody solely doing referrals because you needed to get insurance. Every insurance company is different in what they require. When you order an MRI or you order, you want them to see a consult, a specialist. Fighting to get paid. I mean, some of the stories I could tell you from when I was in practice were insane. So we're talking back even in 2000, where the private insurers all have little games to keep your money. You pay your insurance company. They
Sure.
want to keep your money as long as they can to get interest and whatever on it. So they'll play little games where they will automatically reject a claim. So here I am, a small physician in a small practice, trying to get paid for a service I did. And just like when you go to call your insurance company, you're on hold for a really long time. So are we as providers. So that means one of my employees is sitting on the telephone while I'm still trying to treat patients and take care of them. So you end up as a small provider with a staff size you can't possibly support. So I got to a point where I was either going to have to grow very, very large or take a position, and I opted on the latter.
So you spent your time in med school studying the human body,
right.
Not necessarily earning an MBA, for instance.
Exactly, and that climate is changing. So it used to be pretty simple, like, it wasn't all these games. In the old days, you submitted the claim and they paid you, which seems pretty fair to me. I saw your patient, I treated them, just pay me for what I did. But to have a claim rejected, one example, because we have to code, is, I saw a patient, so there was an office visit in menopause, and they tried to tell me that diagnosis and procedure don't go together. Really?
Yeah. But what does it mean for, say, small town America? I mean, you're not going to have, if there's a one doctor town or even several towns that share a doctor, that doctor's not necessarily going to be able to ally himself or herself with some big corporate entity.
Yes and no. So this has been an issue ongoing. This dates back for at least 20, 30 years that we've known that there's a shortage in certain areas. This is where the U.S. Health Service Corps comes in. So the government will actually help pay off your student loans if you go practice in an area like that.
But
so
you're still going to have those problems with billing and
Absolutely.
so forth.
There are, because there's still referral centers. So, for example, when I was in Oregon, we at OHSU were the referral center for most of the state, as you can imagine. Now, I did some of my rotations in some very rural areas, but those doctors were partly supported by the hospital, by the university, because the ultimate referrals would go to them. So it's still possible, so even in rural town America, for them to ally themselves with whatever the nearest major medical center is. So, and there will still be ones who want to be out on their own and find a way to do it. We've got a lot of different models being explored now. That is the advantage of healthcare reform, is that CMS has started a whole Center for Innovation. So where they're looking at different forms of reimbursement so that doctors don't have to go through that. And that's what we have to see, is what's going to work in New York City is not going to be the same as what's going to work in Arkansas.
But it's likely that people are going to see, people who have enjoyed a one-on-one relationship with their small office family practitioner, that's going away, you think?
Probably.
Yeah. Dr. Kathleen London, thank you.